I saw this on Our Medicine today, and I thought it was kind of interesting. So, New Jersey hospitals lose a court battle challenging charity care. So this is a little bit different than EMTALA. So EMTALA is a federal law that requires hospitals that take Medicare to not turn anyone away. So if someone comes to the emergency room, you are required to take care of them and stabilize them, and that cannot be dependent on their ability to pay. So in New Jersey, this is a little bit different than EMTALA. They also have a state law that is similar where you take care of anyone that comes in, and they have funding that's attached to it. So it's a charity care program. So if somebody comes into the emergency room and they have some problem, the hospital will receive money from the state for their care. Here's the thing though, is that the charity care isn't enough to cover the patient's care frequently, and they do not pay every hospital equally for the patient's care. So if the hospital has a high percentage of charity care patients, they are more likely to get the entire visit or most of the visit paid for. If they only take care of a small percentage of charity care patients, they will get a lower percentage, so less of the visit paid for. So the hospitals in New Jersey are arguing that this is not lawful because they're basically, the government is seizing things from you as a private institution. So they're taking things from you. They're taking your resources and not giving you money compensation for that. And the response from the judges are kind of interesting. They say that we're not taking something from you. When you have the patients in your care, you're the one deciding to give them things, which is kind of a weird response because you're telling the hospitals they have to care for a patient, which requires use of resources, but since you're not the one telling them which resources, it's not taking resources. I don't quite understand the logic. So I think this is a really interesting subject because you are in fact telling people to care for someone and use resources without proper reimbursement. Like New Jersey has this system where hospitals get some reimbursement, but most states don't. And so they just eat the cost of caring for people without insurance. And now that more people's insurance is going to be cut, we're going to have more people in this situation, which means hospitals will be losing even more money on these patient populations. And the amount of people coming in with emergencies is going to increase because as people lose insurance, they don't have proper primary care, problems go longer and become more severe, and they end up in ERs instead of being managed outpatient. And I think all of us in the medical community will tell you that the right thing to do is to care for people that need care. But the reality of doing that is that it costs money. The staff, the supplies, everything costs money. And if you're not getting it, those populations are potentially going to bankrupt hospitals. And the hospitals with the highest percentage of those patients are often the least funded and are most likely to close. So this is going to potentially go to the Supreme Court. So it will be interesting to see how this plays out. Let me know your thoughts in the comments.